Hi, everyone. I'm extremely excited to be speaking with Dr. Amber Orman today. Dr. Orman is a double board certified radiation oncologist and lifestyle medicine specialist, focusing on breast cancer treatment and prevention. She is the first ever Chief Wellness Officer of Advent Health Medical Group, working to improve the well being of her colleagues. She's also the co-founder of the HEAL Healthy Eating and Active Lifestyle program at Advent Health in Orlando, Florida. HEAL is an 8-week lifestyle medicine program designed to educate and inspire cancer patients to make positive changes to decrease cancer recurrence and overall improve overall health span. She collaborates with the American College of Lifestyle Medicine as a member of the Health Systems Council and also serves as the chair of the Cancer Member Interest Group. She's a mother to three teenagers and two poodles, a wife to a witty nephrologist, loves her daily yoga, and spends her free time trail running and summiting Colorado's peaks. So, Amber, thanks so much for being on this podcast and welcome.
My pleasure. Thank you so much for the invite. I'm really looking forward to this.
Great. So, I wanted to begin by asking you about your journey into medicine and a little bit about why you chose lifestyle medicine as your specialty and as your focus area. Not a lot of physicians go into that, coming from more of a conventional background. So I'm very interested to hear what led you into that path.
Yeah, I found it kind of as a combination of my personal and professional journey. And so I guess if we start from the beginning, I got into medicine because my mother is a nurse, and I noticed that she seemed really happy when she was at work.
Hmm.
And so when we would go visit her at work, or I would go volunteer on her unit, she was in kind of, they called it ambulatory surgery. So it
Hmm.
was pre-op, post-op, and she worked in endoscopy for a time and on the
Hmm.
floor for a time. And so I would visit her and volunteer and see how she was around her coworkers and her patients. And it was a whole different side of her that I didn't see necessarily at home. And I could tell that she really enjoyed taking care of other people. And I just felt like that was really the path for me. I've always been very service oriented
Hmm.
and really fulfilled by that type of work. And so I thought, what better career than medicine, where you're just taking care of people all day? So I went into medicine, and I was very interested in cancer.
Hmm.
We have cancer in my family, of course. Everybody's touched by
Hmm.
cancer. But I found it very fascinating because I felt like it was a field where we were going to have, constant developments and discoveries, and just a lot of learning. And it wouldn't be some sort of static thing where I was kind of cookbooking my way through. And so I was very interested in oncology. And I decided I wanted to be a medical oncologist. But then I stumbled onto the field of radiation oncology,
Yeah.
which fit my engineering background perfectly, and kind of found my home there. In terms of the lifestyle medicine piece, that really came in first personally when I was in college, studying in my undergraduate engineering school. And I had, moved away from home, and I was eating the food in the cafeteria, which didn't taste like the food at home.
Mhm. Right.
And at home, I had grown up on a farm, and we weren't farmers in the traditional sense, but we would rent land out. And every year we would get a cow as part of the payment for, the cows being allowed to graze on our property. And so the meat I was eating was, probably pretty premium meat as we would, see it today in the store. So it was, not injected with anything, and grass fed and free range and, organic, all the buzzwords that we look for. And the meat in the cafeteria didn't taste like the meat at home. And I thought, how can a cow not taste like a cow? Like, what's going
Right.
on here? Aren't they all just, meat? And that really put me down this rabbit hole of nutrition that I've really been in ever since. And so I started learning about, what can we do to optimize our performance with nutrition, because I was a student and in a very stressful program, kind of a glutton for punishment. So I thought, go to an engineering school before medical school to just make it extra rough so that I know how to suffer by the time medical school comes. And I was suffering, and I wanted to, learn about everything that I could do to optimize my performance in school, the way that I felt, my attention span, the amount of time I was able to dedicate towards studying, my energy level, the way that my body felt, my sleep, all of
Mm.
these things. And so I started learning about plant predominant nutrition, and over a period of probably 7 to 10 years, transitioned myself from, a decently healthy omnivore to whole food plant based. And I have been there for many, many years. And so I had gone on this personal journey, and then I'm, going through my medical school education, and I'm noticing that nobody's saying anything about nutrition.
Yeah.
And so I had zero nutrition training, and I was, letting this personal interest percolate in the nooks and crannies of my day, and learning more and more kind of independently, and had amassed this bit of knowledge. And so kind of started using it on my patients, and I'd get called in to see other people's patients during residency and kind of talk to them about lifestyle. And then I found a program at the University of Miami where I was training in my residency, where we would get together and study more functional medicine. And so I had that knowledge, kept applying it, and eventually in my career pathway ran into one of the past presidents of American College of Lifestyle Medicine as I was preaching plant-based diet
Yeah.
during a new employee orientation at my current job years ago. And he said, do you know about ACLM? You should really check him out, because I think you might fit in well there. And so I immediately joined and got board certified in lifestyle medicine the next time that they gave the test. And that's really been where I found my home in terms of the way I practiced with my patients. It's really what I was, doing in my personal life and with my patients before I even knew it existed. But it really solidified what I was doing, expanded my knowledge, and then of course opened me up to this beautiful community of people that is ACLM. And so that's kind of how I got here. Just a personal and professional hunger for what can we do to live better.
Yeah, that's a fantastic story, and it's interesting how not a lot of patients and even providers realize that there's an American College of Lifestyle Medicine, that it's a specialty, and also nutrition is just something that is fascinating to see how many physicians go on a nutrition journey once they've finished medical school, rather than get the basics of that in medical school. It's rather sad that we don't get more of that, but such is the system we live in. It's also very interesting to hear about your mother's background in nursing and how she really enjoyed it, because we can see the real decline of that. As a side note, that field of nursing now, to the state it's in, where a lot of nurses are really leaving, especially after the pandemic, in mass. Just, the nursing field is similar to the physician field, has become very corporatized, and that love of medicine is going away in a lot of people. So it's really good to reflect back on times when, nurses and physicians really love to do what they do, and, enjoyed going to their job. So that's just a side note. Um, so we're talking about cancer, and more specifically breast cancer today. And, this is, as you mentioned, this is something that most people, even physicians, have dealt with personally in some personal capacity. with a family member. I know I have with my grandmother. She died eventually of metastatic breast cancer. My mother-in-law as well. I've seen her firsthand because she got the diagnosis when she was living with us, and we had to take her to all of her testing and there. So I got to see it from the patient side, which is a much more human experience than seeing it from the practitioner side. Um, and so it's such an important topic because so many women go through it or fear they're going to go through it if they don't get the diagnosis. So I want to ask you first, because when we think of cancer, automatically we think about genes. So I wanted to ask you about what role genes play in the development of cancer more generally, and maybe if you could touch on breast cancer more specifically.
Sure. Now, that's a great question. And it's interesting the different perspectives on this. I mean, you'll find different numbers, of course, because we're always learning more. We're learning more about what genes are involved in cancer. And I'll have patients who will have a genetic analysis done. Let's say, they had one 5 years ago,
Mhm.
and they'll get a call 5 years later notifying them that there's been a gene identified that they have that's involved in
Right.
XYZ. So this is a very fluid process, if you will, because we're constantly learning. But when we're talking about breast cancer specifically, most sources will tell you 5, maybe 10% of breast cancers have a genetic component.
Mhm.
And I think that this is it's kind of eye-opening because we often think, well, if it's quote unquote running in the family,
Mhm.
surely we're passing this on. But what also runs in the family is the way that we live.
Mhm.
And I think, it's so important that we get this message out about how important it is,
Yeah.
to have a healthy lifestyle if your goal is to maintain a certain health span. I love that term,
Mhm.
because it's very empowering.
Yeah.
Now, some people say, well, this is also puts the blame on the patient. If you tell them, well, only 5 to 10% of these have a genetic component, and the rest is, some soup of all the things that you've done and been exposed to and been around, and your
Mhm.
relationships and your stress and your sleep and all this stuff. And then some people can take that as, my gosh, I caused this on my own. And I try to always, help patients who see it that way to reframe it as, no, this is really empowering, because the beauty of this is that we do know that the way that we live has a
Mhm.
lot to do with our level of health, but it
Yeah.
also can have a lot to do with reducing our risk of this coming back, because
Yeah.
we're in the situation that we're in now. If we have a cancer diagnosis, there's no way to make that go away.
Yeah.
We have to face this and have to deal with it. And knowing that, the way that you live can really impact your outcomes, your recurrence rates, and also, other health conditions that you may have or may be at risk for developing. I
Yeah.
think that
So it's
that is really the
modifiable,
way to
right?
look at this. Yes.
Yeah.
And we see that, in our patients who make big lifestyle changes. We'll often see their diabetes go into remission, and their high blood
Mhm.
pressure, resolve, and their cholesterol normalize, and depression can improve, anxiety can improve, the way they feel, of course, they're losing weight. All of these things can be kind of a positive side effect of this experience of cancer if a patient chooses to tackle it by making a lot of positive changes to optimize the way that they're living.
Yeah. And I think you're right. It's very empowering because if you hear the numbers of 5 to 10% of breast cancer coming from solely a genetic cause, then you realize that there's so many modifiable risk factors in this process. And while yes, you can think of it from the perspective of, it's my fault or I caused this, that framework can be there. It's also extremely empowering, like you mentioned, to know that there's so many modifiable risk factors and you can really in a sense have your own fate and or modify your own fate is from the choices that you make. So that's incredibly powerful. And to that, I wanted to ask you more specifics on what are those things that, in terms of lifestyle, in terms of nutrition, sleep, stress, that folks will do that will increase their risk of development of cancer, and then we can go into maybe the opposite of those things that can help their treatment forward.
Absolutely. And I'd just like to add one thing about the genetic component. Patients that are carrying a genetic mutation, for example, the BRCA1 or BRCA2
Hmm.
mutation, they do have a substantial increase in their risk of breast and other cancers.
Hmm.
But we also can modify the expression of our genes with the way that we live.
Right.
Okay. And this is the whole field of what we call epigenetics. And it's fascinating because we can actually turn genes on and off. And
Right.
so we'll sometimes run across a 75-year-old that suddenly we discover has a BRCA1 mutation. And
Yeah.
this is what we will typically associate with a younger breast cancer that presents early,
Mm.
and they'll undergo bilateral mastectomies as a prophylactic measure. And to find this in a 75-year-old is very curious, but it just demonstrates the fact that even if the gene is present, this is not an on-off switch.
Yeah.
This is a gradient, it's a risk. And even that risk, even though you're starting at kind of a higher baseline, it's still a modifiable risk. And we have so much power. And so, what are the things that we can do to reduce our risk of getting breast cancer or many other chronic diseases for that matter? Because
Yeah.
if we think about, all of the top causes of death in this country, cardiovascular disease and cancer are our top two. These are very interrelated in that they're all kind of rooted in an inflammatory process,
Yeah.
as is, diabetes and hypertension and hyperlipidemia.
Hmm.
This is why all of these things can sometimes come out of nowhere. You find yourself, you're 65, and all of a sudden you go to the doctor and they say, oh my gosh, you now have diabetes and your blood pressure's too high and your cholesterol's too high and your weight is creeping up. And here's 6 pills and I'll see you
Hmm.
in 3 months to see how it's going.
Yeah.
These can kind of come on the scene together because they're very similar. And so, when we're talking to our patients about what can we do, to reduce our risk of, kind of obtaining these things as we get older, a lot of it has to do with our food. And
Hmm.
so we always counsel our patients, towards a plant predominant diet. And what does that mean for each individual patient? I don't know. You've got to find, a place that works well in your life, with your family, with your schedule,
Yeah.
but something that is sustainable and consisting of mostly good whole plant foods, meaning, vegetables, fruits, beans, grains, nuts, and seeds.
Hmm.
And then we start talking about movement, okay? And we know, the guidelines say we need 30 minutes of moderate physical activity, most days of the week, at least
Hmm.
5 days of the week, with a couple of days of strength training. And don't forget your flexibility, so we'll tell everybody this, but what does that mean to you in your day? Well, it may mean that you do 3 minutes of body weight squats while you're making your coffee, and then another 3 minutes of push-ups on the countertop while your toast is in the toaster, and so you've got to take our recommendations and make them fit
Hmm.
into, the box that is your life.
Right.
Then we start talking about sleep, and sleep is so important. And, I kind of, in my mind, always try to figure out, okay, what's the hierarchy? What's most important in all of these things? And I don't know that I can answer that, but sleep is definitely one of the foundational things, because if you're not sleeping enough and sleeping well,
Yeah.
then your hormones are all out of whack. You don't feel like eating well. You don't feel like moving. You're stressed.
Mm.
Your
Your immune
relationships are
system.
failing because you're not at your best, So sleep is a very
Yeah.
foundational thing. And so we sometimes think that it's just, not as important as the other things, but sometimes the other things fall apart if the sleep isn't there. We also talk about stress. How are you handling stress? We
Yeah.
can't avoid stress. We all know what stress is. We all experience it, and it can even be a good thing for us.
Hmm.
But how can we create distance between whatever the situation is and our response so that we're not internalizing the stress? We are responding rather than reacting.
Yeah.
The other things we talk about are substances. And so a lot of times breast cancer patients don't realize that alcohol causes cancer. There's no safe amount of alcohol. It is not a cure-all for heart disease. It is something that we need to avoid optimally, but certainly use responsibly and very much in moderation if we're looking to, kind of optimize and lower our risk of breast cancer, other cancers, and other diseases.
Hmm.
And then the final thing we talk about is relationships. And so, the Surgeon General came out recently with a big campaign talking about loneliness and its effect on our health. And loneliness can affect everything. I mean, it's a risk factor for premature death, and it's been equated to smoking 15 cigarettes a day.
Yeah. Remarkable.
And so we talk about relationships and how important quality relationships are, actual human relationships where you're sharing a space with somebody rather than amassing a social media audience that you never really interact with.
Yeah.
So those are the,
Or never
six.
interact positively with, right? Yeah.
Exactly. So those are kind of the key: your food, your movement, your sleep, your stress, your substances, and your relationships. And then, to answer your second question, what are we talking about when we're talking about kind of what we call tertiary prevention or preventing risk of recurrence? They're the same things. It's
Hmm.
the same things because, if we're talking at the end of the day about inflammation and optimizing immune system and optimizing gut microbiome and these things being central to our health, reducing risk of cancer recurrence is the same process. We want to optimize our immune system, our microbiome, and reduce inflammation in our body.
Yeah.
And that's really, how we get there.
Yeah, absolutely. Thanks for laying out all those one by one. I think that if we take cancer as a chronic disease, it much in the similar way that we look at diabetes and other inflammatory conditions, then we can focus on those foundations that you mentioned of nutrition, stress, sleep, and movement, which I tend to focus on with every patient, whether they have it's like fill in the blank what you have, but you can benefit from that by focusing on these foundations. So very important that you mentioned that.
Absolutely.
So I want to ask you more specifically now. So a patient comes to you and they have the diagnosis of breast cancer. And so what is your approach in terms of you have the conventional side of things where you're a radiation oncologist and you're seeing them from that perspective, and you have the lifestyle piece of it. So how do you, as a physician, incorporate those two things together? Do you say that here are your options treatment wise, and I highly suggest you get these. And then while you do this, there's an important lifestyle piece that you also have to do for the treatment of your cancer and prevention of recurrence. So I'd love to hear. And I think it's great for patients to hear, but also for practitioners and physicians like myself who want to incorporate those two things together, how you do that and maintain that balance.
Yeah, it's a great question. And I'd say that I'm constantly modifying this in terms of my approach, but also it has to be modified for each patient. I don't think that there's a perfect formula to apply to every patient. And so, typically a patient will make it to me because they have a breast cancer and they need radiation. I do see patients primarily for lifestyle medicine that have a cancer diagnosis, but it's less common. And usually they're coming to me for the radiation and know what's coming because they've probably heard about my approach,
Sure.
or they're completely surprised when I start talking about, broccoli, sprouts, and green tea.
Right.
So I I try to feel the patient out really in
Mm,
terms of what is their level of overwhelm.
mm,
Are we at a place where this is an appropriate conversation to have with them, or is it better saved for a later visit? And so that's always in the back of my mind. What can I do to best support this patient right now? And sometimes it is not talking to them about changing the way that they're eating right now.
yeah.
Sometimes it's, talking to them about their sleep, or how they're processing their emotions, or how they're communicating with their family members and their friends. Are they setting appropriate boundaries at this time so that they're able to focus on themselves, and also, surrounding themselves with healthy people at this time? Because as every patient tells me, you get a cancer diagnosis and then suddenly here come the troops. Everybody has their advice, and that can be very helpful, but it can also be very overwhelming to a patient. And so oftentimes what we start with is, how's it going with the people around you? Are
Mhm,
you supported? Do you have what you need at
mhm,
home? And sometimes it's a family counseling session where I'm talking to the spouse, and they're kind of both experiencing frustration with, the spouse telling the patient, sit down, I'll do everything for you. The patient feeling that that is, completely disempowering and wanting to maintain a sense of normalcy. And so these dynamics, I think, often bubble up, and we kind of have to, get through that before
right.
we can start, navigating this world of lifestyle change.
Yeah.
But I certainly do eventually get there. And I start with each patient individually, really asking them, what does your current life look like? What are your goals in terms of, your health? What is it that you want to do in the future? What's your purpose? Like, why do you want to change any of this? And trying
Yeah.
to help them kind of get the mindset wrapped around, why would we first even want to make changes, and
Mm,
then get into the logistics of the changes and the why, are we recommending that you increase your intake of plants and move your body more, and kind of provide them more of the, the science behind it, and but in an approachable way. I'm not the doctor that like tosses a bunch of statistics. I try to talk about it in a way that I've made sense of it in my own mind,
mhm,
so that they really understand, okay, that actually makes sense in terms of why I want to do this. Not just because you said so, but because I understand I need more fiber for a healthy gut microbiome and a healthy immune system and more natural killer cells. So I'll kind of explain it to them, and then we start working into the actual, what do we do and how do we do it. And usually I will guide patients towards our 8-week program, which I know you mentioned in the beginning. It's called HEAL,
mhm,
Healthy Eating Active Lifestyle.
yeah.
And it was really created because doing this with each patient individually is very, very time consuming. And it
Yeah.
also does not create a sense of community if I'm
Mm,
just working with them individually.
yeah.
And, we spoke about loneliness earlier. It's a real thing. Toss in a cancer diagnosis, and it's like gas on the fire
Mhm,
of loneliness. And so the the HEAL program is really meant so that I can spend more time with patients to give them more information about all of these, kind of 6 pillars of lifestyle medicine as it relates to their cancer, and their other diagnoses, if that's the case. But it also starts to create a supportive community amongst the patients, so that they don't feel as alone. They know that, there are other people going through this. They can learn from their experiences and start to support each other as we grow this community. And so that's kind of how I've where I'm at now. I may be doing it differently in a year.
Yeah, no, we're constantly evolving, and that's a good thing. I see patients in my practice very much on a one-to-one basis, right? Because I'm trying to take each patient's, give them a very individualized approach. But I am always struck by whenever I do have two of my patients, even just two of my patients in the office at the same time getting an IV treatment in the next room, I'm just amazed at the connection that they have just spontaneously made. And just starting to hear this support, it's just really incredible where one person is sharing their story, the other person is sharing theirs, and then immediately getting that validation, the support, and the encouragement that you can really get better makes me really think that I should have more of that community all at the same time. So I should be looking at the exact same program where I can get more patients together, have that community feel, and try to achieve whatever goal we're trying to achieve. So I really appreciate that you've put it into a very organized 8-week program, and I'm sure a lot of patients are getting tremendous benefit from it.
Yes, and I'll tell you, it has been just for me such a rewarding thing to interact with my patients in this way because each session is 90 minutes to 2 hours long. And so we're really spending a lot of time with each other.
Yeah.
And it's a whole different way of practicing medicine. And I love it. And I know that it has protected me from burnout because I just feel like this is what it's about. We are actually helping them live healthier lives. They're, doing this with their families, their friends are getting involved.
Yeah.
It's like you're creating this movement
Right.
that spreads. It's infectious in a good way, and
Mhm.
so it's just been such a great experience. And after I quote unquote retire from medicine, I know that I'll continue, doing this in some way, shape, or form because it's just such amazing work, and I feel like it makes such a big impact.
That's amazing. Yeah. So as we wrap up, Amber, I wanted to know if there's any kind of last message or overall message you want to give to someone struggling with a breast cancer diagnosis or a general cancer diagnosis, and just some words of encouragement to that person or patient.
Absolutely. I'd say, first of all, you're not alone. I mean, we know the statistics, it's very common. We've all heard that, but it can be so isolating, despite the fact that it seems like everybody's touched by cancer. And so find a community of people to
Mhm.
support you. And maybe that is just your family. Maybe that is a formal support group.
Mhm.
It can take many forms, but that's a space where you can be vulnerable, and vulnerability is where deep community is born.
Yeah.
And so I think that is totally essential for really thriving through this experience is community. And, if you're looking for somebody to guide you through how can I change my life so that I'm reducing my risk of recurrence, find a lifestyle medicine
Mhm.
physician, or, you can find talks online about this. You could probably Google me and find something. I feel like I'm
Right.
talking about this all the time. It's my favorite thing to talk about.
Yeah.
So, but find that guidance
Mhm.
from somebody who, is talking about the way that you live, not, 600 different supplements, but what
Mhm.
can we do in the day to day
Yeah.
to actually, increase our health? And the goal, for people that go through the HEAL program, my goal for them is always that you leave this program feeling better than you felt before cancer.
Yeah.
And that's often the case. And so don't feel like this is the end for you. Sometimes, in the suffering, there's good things buried, and we've got to find those things. And so finding the good in the suffering can often lead to, very positive, life-changing things. And I think that does start with community and supportive people around you.
Yeah. Such an important, powerful message. So thank you for sharing that.
My
Well, this has
pleasure.
been such a great conversation. I really appreciate you coming on and talking and sharing your wisdom around this. So thank you again and look forward to talking to you more in the future.
Thank you so much. Thank you for having me.
Absolutely.